Good afternoon. Questions to Ministers on Health and Wellbeing. Question number 2, Shirley-Anne Somerville.
To ask the Scottish Government what reports it has received from NHS Lothian regarding the New Pyjamas campaign organised by the Sick Kids Friends Foundation.
Minister.
I am obviously aware of recent media reports regarding the New Pyjamas campaign organised by the Sick Kids Friends Foundation. NHS Lothian has confirmed that it has recently met with representatives from the Sick Kids Friends Foundation and will be working with them to ensure a successful fundraising campaign with the appropriate governance structure. I have asked NHS Lothian to keep me fully up to date with the situation.
Somerville.
Can I thank the Cabinet Secretary for her answer? I welcome the investigations that are now being carried out into this matter by Oscar and NHS Lothian. However, does the Cabinet Secretary agree with me that whilst it is important that these investigations are completed as soon as possible and any action necessary is taken, we should never lose sight of the fantastic work that has been undertaken in the past by the Sick Kids Friends Foundation? She will be aware that my family had cause to spend time at the Sick Kids quite recently and saw at first hand the results of the fundraising efforts and the differences that it really does make to patients and families alike. And does she therefore join with me in encouraging people both in Edinburgh and further afield to continue to support the very worthy fundraising work for facilities at the new hospital at Little France?
Can I thank Shirley-Anne Somerville for that question? Before I answer the substance of it, I am sure she and other members would agree that it is vitally important that the allegations that have been made are properly investigated. That is not a matter for me or the Government, that is obviously a matter for Oscar. And I do know that the Sick Kids Friends Foundation has made it very clear that they will be cooperating fully with Oscar, and everybody will welcome that. But I do think Shirley-Anne Somerville is right to draw attention to the fantastic work that has been done and I hope will continue to be done by the Sick Kids Friends Foundation. Parents like Shirley-Anne Somerville who have seen the direct benefits of that with their own children will know that it is impossible to put a value on that work. But as Health Secretary, I have also seen on my visits the benefits of that kind of work and the difference it can make in the lives of sick children. So I am sure we all want to see the Friends Foundation go from strength to strength and continue to work with NHS Lothian as they do so.
Good afternoon. Questions on rural affairs and the environment. Somerville.
As the Minister knows, the Greener Scotland objectives include improving Scotland's built environment and sustainable use and enjoyment of it. And one way of improving the use and enjoyment of the built environment is through the provision of allotments and community gardens. I am sure the Minister is already aware that NHS Lothian has recently made land available to the Royal Edinburgh Hospital for such a community garden. Would the Scottish Government consider pursuing its Greener Scotland objectives by encouraging other health boards and government departments to undertake an audit of available land to identify further possible sites for allotments and community gardens to meet the growing demand that we have in our cities?
I recognise the member's continuing interest in this particular area of government policy. The Scottish Government is very well aware of NHS Lothian's plans to create gardens and grow your own spaces. The Grow Your Own working group is taking an active interest in the proposals that NHS Lothian are unrolling. If successful, they certainly could be used as a model to utilise government-owned land elsewhere. Of course, the NHS will still maintain overall control of the land.